That was a week that changed our lives. That was a week that changed the world for us. The first thing that stands out is how helpless a person can feel, how helpless you can feel when something is going on like this and you're not getting answers. The first time when I took her to a medical facility that first day, I believe it was a Tuesday afternoon, and I realized that the nearest emergency room was in La Crosse. And I remember sitting there watching her shake and thinking, doing the calculations and thinking, okay, there might be an ambulance in the neighborhood, but chances are I can get her to the urgent care in Onalaska faster than an ambulance come in. If she needs to be stabilized, they could stabilize her there and call the ambulance, and it would be far more suitable than them going to a store parking lot. I walked in, and I can't remember where it was, or if it was in the lobby area, or if she was in a room, I can't remember, but I remember the vision of her sitting completely wrapped in white blankets with an IV in her arm. And I also remember being told, you know, this is not an ER. She has a virus, take her home. Got her a digital thermometer, and we noticed that her temperature was going up and down. It wasn't going up into the 104, 105, but it was certainly abnormally high. And then it would go below normal. And I remember we'd call the nurse line, and she wasn't eating, she wasn't drinking, she was having these shaking spells, particularly she would say after showers. And at a certain point, she started to also have severe abdominal discomfort. And on Friday, late Friday evening, I took her in again. We drove from Sparta to La Crosse, and I took her to the ER. That one I remember very clearly. I came up to the ER entrance. It was a terrible drive. There are sounds that people make when they're in pain. It's not open sobbing, but when someone's trying to hold in pain but not succeeding. And we got into the ER parking lot, and again, at this point, she couldn't get out of the car by herself. She was leaning back in the seat. So this time they got a gurney and brought her in because she was in so much pain. I remember her being told over and over not to be so anxious. Don't be so anxious. And I remember thinking, yes, Dawn has a pre-existing diagnosis of depression and anxiety, but she's been dealing with that for a while. She knows the difference between an anxiety attack and a bellyache. I remember at one point they were trying to get her to give a urine sample, and I remember the nurse holding it up, and I was in her presence. And I remember the vial coming up, and I'm going, that's not right. But then they diagnosed her with a bladder infection, and they had given her more fluids. And I thought, well, maybe it was just severe dehydration. What I know now is we were looking at kidney failure in a cup. And they told us she had a bladder infection, gave us a prescription for antibiotics, which we had filled middle of the night at Walgreens in downtown La Crosse, and then went home. And I remember distinctly being over at her house on that final Sunday afternoon. And I asked how she was doing. She was not doing well. I remember the conversation more than anything, more than any physical symptoms. But I remember her symptoms hadn't gotten better. And we actually called the nurse advisor line through the clinic system and said, we really think something's wrong. Should we bring her in? And the nurse said, well, no, let's let it wait for a little while to give the antibiotics a chance to work. If we'd taken that advice, she'd be dead. And I asked her what she would think of going back to the ER. I don't know what she would have said. What I would have done is she'd said no. And she looked at me, she goes, yeah, I think that's a good idea. And one of the doctors who was on that night, I believe, came up to me and said, well, she has a gallbladder infection, so she'll need to come back in and be seen. And I got the strong impression at that point that they were going to send her home again. And I asked the doctor, what are the chances that she's got the first bladder infection of her life and an infected gallbladder at the same time? And I remember her kind of looking at me and going, it's a coincidence. We found out afterwards, very thankfully, that the surgeon who was in charge of the ER that night had never been in our room, but was looking at the test results coming in and did not like the numbers he was seeing. Apparently, my impression is he advocated to get her admitted to the ICU. And I got the phone call at about 10 in the morning, I think, or 10:30, woke me up, a very confused phone call with the, I believe it was some of the nursing staff who was right there with her as she was being wheeled into the operating room after the CT attempt. And she was crashing, and apparently one of the last things she was able to say was to have them call me. That's when things started.
When I did wake up in the hospital and I was told what it was, I remember hearing about what it was, but I did not know exactly what it was. All I knew was before I was admitted to the hospital, something was not right, and sepsis was not on my radar at all. I don't know as if I necessarily knew how sick I was. I did know that something needed to be taken care of. What I really wish would have happened is that I would have been listened to, and my advocate, Sarah, at the time would have been listened to, that I was going for help, but I wasn't really getting much of help. I wasn't necessarily getting better. I was going home, I was being sent home only to feel worse, and I didn't understand why.
I was on call for general surgery, and I received a call from one of my senior surgery residents, Dr. Bray. And then her story was basically a pretty sick patient down in the ER. So I went down and saw her, and at that point she had been evaluated by other docs talking to her, getting some labs and getting pictures, and all we knew was that she was really, really sick. They had done an ultrasound of her gallbladder, and between that and some abnormal liver numbers, we were worried that she had a bad gallbladder infection or something called cholangitis. But she also had some pain on her left side too, which didn't fit. So when I first got involved, I knew she was sick, but I didn't know kind of what was causing her to be so sick. Her story wasn't clear at the beginning. So I think within the first couple of minutes of me being in the room, it was pretty clear that she was septic due to something. But the harder question was, what was that to? What was that due to, excuse me. So we started her right away in the ER on antibiotics. We started giving her IV fluids. She met sepsis and even septic shock criteria in the emergency room. We wanted to get more information to try to figure out what was causing her sepsis. Was it what the first picture showed? Was it just her gallbladder, or was there something else going on? And the story over time was that we found that she had a hole in her colon, which was leading to the sepsis, but also caused trouble up by her liver with a portal vein thrombosis. So that's why she was having right-sided and left-sided pain. So the hole in her colon is what was leading to the sepsis. The most memorable thing for her, this is the very first and most sick patient that I had taken care of. I mean, when you looked at her from the door, you were really worried about her. I mean, she was a young woman at that time, but clearly worried about loss of life in her with how sick her whole body was from the severity of the infection. I think that was the most striking thing to me up front. And then as I got the opportunity to take care of her over months, the other thing that struck me, I mean, she had a very, very long, hard course recovering from her initial surgery, with some bumps in the road afterwards because she was so sick when we started. To have the trust in us, to trust in the medical system to come back and have her stoma or ostomy reversed or bag taken down. That was another kind of strong, spoke well to her strength and her perseverance through all of this.
This was a true septic shock patient in the truest sense of multi-system organ failure, and even to the point of losing digits, fingers, toes that started to turn black, and she was able to come back from that. So catching sepsis or septic shock and finding the source, we were able to gain control. Dr. Smith was able to gain control, and we were able to start her treatment from there. She still is the patient that I remember as true septic shock patient.
Absolutely.
That from each day to day, we were not for sure if she was going to survive.
The breadth of the diagnoses that can lead to shock are so broad that I think that's the challenge. It's easy to say, so this patient has acute coronary syndrome or stroke, but septic shock can be caused by UTIs, GI, gallbladder. So I think just the recognition of it, the upfront recognition for our primary care providers, our urgent care providers, and the ER providers is critical. Trying to identify that earlier so maybe she wouldn't have been as sick the next time, or the next patient wouldn't be as sick the next time if we could recognize it earlier.
I believe that every patient provides an opportunity to be thinking about sepsis or occult sepsis and really back up and try to reassess that patient. Just keeping sepsis or occult sepsis from even unknown etiologies at the forefront and evaluating patients going forward would be the message that I would want to give.